Hi, my name is Terri Nuss. I'm the Vice President for Patient Centeredness for the Baylor Health Care System in Dallas-Fort Worth, Texas. Patient-centered care, as most of you likely know, is the IOM defines it as care that is respectful and responsive of the individual's needs, preferences, and values, and then those values factor into their clinical decisions. Understanding what matters to them and then using them to share in plans of care and decisions is really what this work is about. The most important thing that readers should get, that I think all of us should get, is that we are asking people every day to change in the field in multiple ways. This isn't just about being kind and being nice. That's fundamental. It's about building trust, because trust and transparency mean we're going to truly have shared care, and then we'll have the safest, highest quality outcomes. What we've noted over the past 7 years is we have not only asked people to make changes at the bedside in process and in behavior, but we've had to expand thinking for what our stewardship is of patients and their care and healing. And 7 years ago in our healthcare system, we were in a mindset in some areas of, okay, I've discharged the patient and I'm wheeling them to the curb, and so now I can turn around and go focus on my next patient, my next chart, my next project, fill in the blank, whatever that is. Not only do we care for and really have stewardship of that care all the way home, but we've got measures and processes that have to follow that patient all the way home. So it's been changing our philosophies and ways of thinking beyond the discharge process. It's better readying patients and families for what's coming for them in care. And then it's inviting in their family, their loved ones, those that they define as their primary support. One of the things I'm the most proud of in our healthcare system is that we have really endeavored to remove visiting restrictions and to open access to loved ones, and that we've done it systematically and we've done it with leading measures that drive those lag outcomes, and that I can quantitatively tell you where we stand with that today. And that's something that when I talk to colleagues, we don't have handles on that in all areas of the industry. Tackling this programmatically really requires the investment principle, right? 80% planning, 20% doing. And what I admire about our leadership for the Baylor Health Care System is over the decades, they have understood how to plan. We learned in 2011 only 6% of healthcare systems actually have dedicated resources at the corporate level to patient-centeredness. And that was something our board and our leaders had vision for in the late 90s and then executed in the years 2000. So why is a colleague being asked to make what we call a care call all the way to home, this post-discharge call? Why do they do that? There are a lot of folks that believe, let's do that because it's the nice thing to do. It's what happens to me after I buy a car. They call me, they say, how did that go? Do you enjoy your car? How was the salesman? That is not why we're making a call, and we're letting colleagues know. You're calling that patient and that family to see, have they safely arrived home? Do they have the information that they need for their medications, for their physician appointment? Do they understand their discharge instructions? Having worked with patients at the bedside before, I know that you can see them during their length of stay on their last day before they discharge and follow up 4 days later with them in person, and they will not remember having even visited with you. And so our job is to help our colleagues see how these behaviors really begin a domino effect of checking and balancing to ensure they're safe and they land home safely and they've got high quality. So every service behavior we advance, we share with colleagues, here's how it drives safety, here's how you can ensure we have optimal quality outcomes. And finally, all of this is meaningful when the patient trusts us and they can offer back what their own limitations and preferences are. There are folks out there that are starting this journey, that are just realizing what patient-centeredness is, and that's because as an industry it's been challenging to define. Even when it's defined, it's a tough message to transition to another. It's about leadership, right? It starts with having the right leaders in place, having leaders who are impassioned about this work and they believe in quality and they understand how broad quality is. So we've had those leaders with that vision. once you have those leaders in place, then it's about how are we going to actually define and set goals that we agree on. So there's this leadership component and selecting the right people. There's the goal definition. Then it's about continuing to select well and cascading those goals. And then it's about defining and further defining and getting more granular. So if you're just beginning this work, what I think our healthcare system has done well and what I think this book will reveal is the importance of meticulously planning this work. You know, the pace on the journey is dependent on how many people help us and give us advice. But there's wise counsel in, seek the advice of many as you seek to endeavor on your journey.